think it's very fundamental that the leadership and the collaborative team that APP works with, that they are valued, that they have that confidence, and they have that one-on-one mentorship, either from APPs that are already very confident in performing the procedures or the physicians on board. I think if you do not have that fundamental, then things will crumble. There are several opportunities to learn about procedures and dive into that. However, again, if you don't have that foundation from your leadership, it's not going to continue to flourish.
Hello and welcome to our WInnovations podcast. I'm your host and creator, Dr. Kyle A. Richards, and we have a super exciting program planned for today. We're in season 4 and thrilled to be back in the Department of Urology studios at the University of Wisconsin. The purpose of these podcasts is to highlight some of the exciting and innovative work being done here at UW, but also we like to bring in some all-star guests from outside the department to provide unique perspectives and highlight the collaborative efforts that are required to innovate. Now I'm honored to introduce my guests today. We'll start with Corinna Hughes and then Ashli Ellison. Corinna is instructor in urology and urology nurse practitioner at Mayo Clinic in Rochester, Minnesota. She earned her Doctor of Nursing Practice degree from the University of Kentucky and completed the Mayo Clinic Advanced Practice Provider Urology Fellowship in 2021. Her clinical practice spans both male and female urologic conditions and has really gained some unique perspectives and expertise in advanced urologic procedures, including cystoscopy and MRI fusion transperineal prostate biopsies. She has a strong interest in advancing procedural skills and clinical excellence among APPs. In addition, she's actively engaged in APP education, mentorship, and leadership within urology. She's passionate about professional connection and knowledge sharing within the urology community and regularly shares her content, insights, and practical guidance through her Instagram platform at Uro Nurse Practitioner. So definitely check that out. And it's a great honor to have you on the program today, Corinna.
Thank you. I'm happy to be here.
And up next is our other guest, Ashli Ellison. She's a practicing nurse practitioner in the Urology Department here at the University of Wisconsin. She's been part of our team since 2013. Got here about a year before I did. And she did her training at Clark University. She's also a current speaker on the North Central section of the AUA APP webinar series. Ashli has focused her practice on the care of patients with urogynecologic and neurogenic lower urinary tract dysfunction. And I've certainly enjoyed working with her over the past decade plus and are really pleased to have her on the program. Ashli, thanks for being here.
Thank you. I'm excited to be here too.
And I know both of our guests are really passionate about improving and innovating the care of patients with urologic diseases, but also elucidating the role of advanced practice providers in the care of these patients. We're absolutely thrilled to have Corinna and Ashli in the studio for our session, which we are calling Optimizing the Roles of Urologic Providers. Is there an app for that? Or APP for that, I should say. All right, let's just get right into it. I'm going to start with you, Ashli. How did you get interested or involved in urology in the first place?
So when I moved to Madison, I worked on a surgical floor, and that was F66, which took care of patients specializing in gynecology, urology, plastics, and ENT. When I was in nursing school, I kind of always had my dream of being a family nurse practitioner. So I thought I would saw myself in family practice. But when I graduated with my master's, there was an opening in family practice and urology. And I thought I loved taking care of my urology patients on the surgery floor. So I thought I'd give that a shot. And I just found my passion in urology, and I've been here ever since.
That's amazing. And what about you, Corinna?
So I've always been drawn to roles in supporting others through vulnerable situations. Throughout college, whenever I was in nursing school at the University of Kentucky, I was a sexual health educator. So I was talking about safer sex practices, talking about condoms, how to put those on, different STIs, and it was something I loved. After I finished my undergraduate education, I was an ICU nurse for a while. Found that critical care was not for me, but I did want to pursue my doctorate degree. And while in my doctoral program, urology was not a clinical site, but it's something I sought out. So I had reached out to an APP at the University of Kentucky in urology, and I'm like, this is something I think I'm interested in. Shadowed, I made it my own clinical site, knew I loved it, and from then on, I have not stopped exploring urology.
I think you're highlighting that it's so rewarding, some of the intimate discussions that we have with patients, whether it be a new cancer diagnosis all the prostate biopsies you're doing, or talking to them about, sexual impact of various treatments that we're putting them through. For me, it's been similarly fulfilling in the sense that we get to walk those journeys with our patients through various sensitive topics and times, whether it be, cancer, erectile dysfunction, urinary function, things of that nature.
Absolutely. And there's nothing more rewarding than a patient after you're talking about Peyronie's or erectile dysfunction, and they look at you and they say, I came into this conversation very timid and I did not expect you to make me feel so comfortable. Like, that is the most rewarding experience. So
yeah, the amount of trust that patients, place within us is really amazing. I want to take a little step back. Our podcast, I think, reaches a lot of different audiences, some patients, some providers, obviously urologists, and hopefully APPs. But for you, Corinna, how do you broadly define advanced practice providers, and what exactly does that mean? Maybe simplify that a little bit for our listeners.
yeah, so I think the term advanced practice providers is something, within the last several years that we've been trademarking as someone with advanced clinical training and beyond. It is a bridge in between physicians and patients and providing direct care, education, care coordination. As an advanced practice provider, these are individuals that can practice independently or collaboratively with the main goal of patient care and having diagnosing, treating, and managing patient care, and also working alongside others.
Yeah, and we'll get a little bit more, I think, into what APPs for short. So we'll kind of refer to them as APPs. What they can and can't do. I'm curious to get your insights as far as what it's like in Minnesota. I know there are some differences state by state.
Mm-hmm.
Ashli, how do you become an APP? You're a nurse practitioner. There's also physician assistants that get kind of lumped into that same category. But what's the pathway? I think it'd be nice for our listeners to kind of really understand, what do you have to go through to become a nurse practitioner?
Yeah, so to become a nurse practitioner, you're going to first get your nursing degree, and then after you have your nursing degree, you're going to go on to get your advanced practice degree. That will include some classes and also research and clinical hours. Then once you graduate with either your master's or your doctorate, you'll go on to get board certified. On the nursing side, there is also nurse practitioners, certified registered nurse anesthetists, clinical nurse specialists, and certified nurse midwives. And then on the physician side or physician assistant side, they're going to get their undergrad degree. That could be in a variety of areas. And then I think there's certain guidelines you have to have, like practice hours, and then you'll go on to get your physician assistant.
Anything that Ashli left out, Corinna?
No. I have just some little pointers that, nurse practitioners were started in 1965, which I think is always like an interesting point, by Loretta Ford and Dr. Silver. And yeah, as the pursuit, I can't speak a lot to the PA, but for a nurse practitioner, yes, you can pursue your master's or your doctorate. Both you can practice, right? With your doctorate degree typically taking about 4 to 5 years, and your master's 2 to 3 years. And nurse practitioners most of the time are practicing as a nurse during that time throughout their graduate studies.
Yeah, and I wanted to ask you, Corinna, about fellowships. I know you did a urology fellowship at Mayo Clinic, and I've long had interest in potentially establishing one. But for the doctors that are tuning in, we know about fellowships for, oncology. I did a uro-onc fellowship and infertility. But what is an actual fellowship in urology?
So nurse practitioner fellowships were launched in 2007, and those were more for the federally qualified health centers, more like primary or family care settings. And since then, nationwide, there are various fellowships throughout different subspecialties. Within urology, I'll have to look back. I think there may be, 7 to 10, but they have continued to explore what a urology fellowship is. All can differ throughout the nation. So someone that's interested in a fellowship, you really need to look at the length of time and what they are going to be offering you. But most of the urology APP fellowships are 12-month duration. They offer you a stipend. You are working alongside APPs, physicians, different collaborative, practices, whether that's a physical therapist, radiology, and you are going throughout various subspecialties and diving into everything urology. And that may also be an opportunity to practice in a procedural setting too, or in the OR, like UT Southwestern has within their urology fellowship.
Yeah, I think it's a cool model because without a fellowship, if you want to do a specialty, right, there's a fair amount of onboarding and learning that has to happen because there's only so much exposure you get to the different specialties, during your nurse practitioner training. Like Ashli, for example, how much urology were you really exposed to during your nurse practitioner training?
There was no urology rotation in my training.
Yeah, and obviously you've picked it up pretty nicely and had good on the job type training. But it is a neat model. I think it'll be interesting to see how that evolves over the future, because we are certainly dealing with a urology workforce shortage, and we need to find other ways of training providers to help kind of meet that demand.
Mm-hmm.
I think that's a good pivot to sort of what actually APPs can do. You touched on it a bit, Corinna, about APPs practicing independently. Maybe expand a little bit upon that regarding how they can practice, what they can and can't do, any supervision that's required, and I guess does that vary based on your state?
Yes.
I know I asked it was like a long run-on question with like 4 questions packed in.
So the nurse practitioners and physician assistants / associates have variable scope of practices depending on, again, their training, licensure, and state regulations. I cannot speak to the physician assistant / associate aspect as much. I'm not as aware of kind of how that varies state by state. But as far as a nurse practitioner, yes, you can have full practice, reduced practice, or restricted practice. In Minnesota, depending on how many clinical hours that you have and how long you've been in practice, you can have full practice authority. So you can't practice independently without the collaboration or supervision of a physician.
And what about Wisconsin, Ashli? What are some of the rules? Anything unique about our state that you've had to navigate?
Yeah, so back in August of 2025, Governor Evers did pass the Wisconsin APRN Modernization Act. So that did grant nurse practitioners in Wisconsin full practice authority. So that was a win for nurse practitioners, and now you can practice independently.
And the American Associates of Nurse Practitioners do have a great map where it's color-coded, and it'll show you who is full, reduced, restricted. Very helpful, especially if you're exploring.
I think it was like 30 states are full practice authority now.
Yeah. That's 26 states in DC, plus DC.
Oh, okay.
Mm-hmm.
Yeah, and it kind of dovetails into my next question, which was going to be this sort of demand for APPs has seemed to have gone up, certainly since I've been in practice over the past 11 years. Ashli, why do you think there is such a demand, and are APPs equipped, in your mind, to sort of meet the demand?
Yeah, I think that APPs are highly trained and definitely equipped to meet the demands. I feel like there's been some research that has backed that up too. We have an aging population with really complex problems. There's a shortage of healthcare providers across the board. So APPs, physicians, nurses, medical assistants, and that can all lead to a lot of burnout. So it's really important we have as many people as we can working to the top of their scope in order to take care of all the patients we need to.
Yeah, and I would imagine, Corinna, in Minnesota that you're seeing similar issues, especially in probably some of the rural parts of the states where there's very few specialists to help meet the demand.
Absolutely. And I think that's just around the nation. And like, I think referencing AUA's workforce, that they looked at APPs and being utilized within academic versus in like primary or private practices. Academic settings, APPs are being utilized in like 90+ plus percent capacity. And then in private practices around 70-ish. I have to pull up the exact thing. But yeah, I mean, I do work in a rural area, but at the same time, it's a large academic center. So outside of my previous clinical experience in Kentucky, absolutely. I can absolutely reference that, how APPs are needed within that in some of the rural areas, because that's what I grew up in. Here in Minnesota, I do see here in Rochester being a hub where patients can come in from around the rural areas, because I consider Rochester kind of a rural area in a way, ish.
Yeah, definitely. I mean, I've been up there a few times. It's definitely not a big city, but a lot of people come in, right? It's a huge draw for patients, but certainly once you start, leaving the city proper, similarly in Madison, I mean, once you start leaving the city proper, it gets pretty rural in a hurry. And I know we've struggled to get urologists in a lot of the counties in Wisconsin. And I think I'm a big proponent of APPs getting trained up, helping to bridge the gap, because I think it's going to be hard for us to train more urologists in a hurry. And I liked what Ashli said too about people practicing at the peak of their scope as well, not practicing down. So it kind of is a good segue to the next question I had for both of you. And maybe I'll start with Corinna, because I know she has a lot of experience with doing procedures. How do you get trained? And what do you think is the best pathway towards getting advanced practice providers experience with some of the, urologists do a lot of procedures. I do, 15 cystos every clinic, right? So, I mean, a lot of prostate biopsies. What is the pathway for APPs to get training in that?
I think there are several pathways to go about. However, I think it's very fundamental that the leadership and the collaborative team that APP works with, that they are valued, that they have that confidence, and they have that one-on-one mentorship, either from APPs that are already very confident performing the procedures or the physicians on board. I think if you do not have that fundamental, then things will crumble. There are several opportunities to learn about procedures and dive into that. However, again, if you don't have that foundation from your leadership, it's not going to continue to flourish. Some of those opportunities include, again, a urology fellowship, the Urologic Association of Physician Assistant or Physician Associates has a cystoscopy training. That is wonderful. Again, this is for APPs. The Society of Urologic Nurses and Associates also has like a cysto training series, and they have some education on urodynamic study readings too. And then the AUA, do you care if I do a little plug in for the AUA?
I love the AUA.
You got it. I do too. The AUA, for example, on May 14th is hosting a new advanced cystoscopy training for APPs. And also, just like last year, this year in August in Cleveland, Ohio, they are hosting the AUA Fundamentals in Urology. It's a hands-on skill training for ultrasounds, cystos, and different procedural opportunities for APPs. Now, again, these are insights where information can be drawn, just getting some small like fundamentals on how to do the procedures, maybe questions to ask your mentor, but it really comes to the leadership that's within that department or the institute that APP is working in.
Yeah, thanks for plugging that course at the AUA. That's the Thursday before the AUA, May 14th, I believe, was the date. That'll be fantastic. I agree with you that getting buy-in from leadership is usually the first step. I've heard some more. I would say it seems to be more so from some of the more senior urologists, maybe pushing back a little bit about the idea of having APPs do procedures, because that's sort of something that's always been near and dear to urologists. And the thought of, we're giving this away or we're losing our procedures. How do you combat that sort of ideology and get buy-in, I guess? I'm asking for a friend.
Yeah, I do think it's a balance. I mean, one can look at what is your patient demand at the time. Are your patients getting in? Are they getting diagnosis in time? For example, like our transperineal prostate biopsy clinic that was started in 2019, they were not doing very many biopsies in clinic. Though there's a wait list for biopsies. That shouldn't happen. Adding in APPs, they improve their efficiency over 100%. And we do biopsies now in clinic 5 days out of the week, 7 a day. So that in turn, our surgeons who are doing prostatectomies, there are the prostate cancer patients that they can take care of, and they're right here. So it definitely is a balance, and I don't think it should ever be framed as APPs taking procedures away. However, us just working collaboratively to meet the needs of the patient.
Yeah, that's very well said. If you can share with us, what is the actual wait time, average wait time for a prostate biopsy now in your clinic?
Yeah, I'll be very frank and tell you I do not know the exact wait time because I have not ran the metrics. But I will say, based on experience in my work log last week, if I put in an order for a biopsy in clinic with a local anesthetic, knowing that the patient will tolerate it, good blood pressure, all the things, they could probably get in that week. They could get in that week.
That's fair enough, and that's sort of what I thought you would say based on how you described your program. I think that's phenomenal, and I agree with pretty much everything you said there. Ashli, any thoughts on APPs and procedures? It's something that at our institution that's been a little bit, I would say, somewhat challenging to get leadership on board with, but something that we've certainly started to have some discussions about. What are your thoughts, Ashli?
Yeah. Yeah. And I think that would be really exciting if we could bring some of those things to UW also with biopsies and maybe more cystoscopy for APPs. We do some on-the-job training for like complex catheter changes over a wire. I do pessary fittings. Some people will do stent removals in clinic or hydrocele aspirations, testapel. So there is definitely a lot of procedure opportunities for the APPs. Usually you'll watch someone perform the procedure. You might do some hands-on, and then you'll have to do it at least 5 times and show proficiency before you go and do that on your own. So, you and your collaborating physician would make sure you both feel real comfortable before you're going to just be set off to do that by yourself.
And I do think that's a plug for a urology fellowship also. For cystoscopy training, I had to do 200 plus cystoscopies before I was independent, which was wonderful. And when I say cystoscopies, I mean cystos, diagnostic cystos, pulling out stents, replacing suprapubic tubes. Like that was all included within the quote unquote cysto training. And within that, yes, I was confident, still humble enough to take some images. And if I had questions, review it with my collaborating physician or the provider that's taking care of, still asking questions, but it did give a sense of confidence.
Well, I want to switch gears a little bit to a different topic, but one that I don't think comes up too often anymore as APPs have become more commonplace. But maybe, Ashli, I'll start with you on this one. Do you ever get any pushback from patients seeing APPs or saying, "Hello, I want to see the doctor"? Or, does that something that occurs? And if it does, how do you deal with that?
I would say it occurs rarely, but there's been, several instances over my career where maybe someone wasn't happy. Usually, as long as they know, if the scheduling department's real honest, of who the patient's going to be scheduled with, if they know. Sometimes if a patient would come in and they're expecting to be counseled and scheduled for a surgery that day, they might be upset if they'd already seen an outside urologist. But most of the time, if we can kind of figure out what they need and get them to the person they need to see, usually they're really happy with the visit, and we can usually help move things along or meet some of their needs that day when they're in clinic.
And what about you, Corinna? Have you had any experiences like that?
I agree. I do think there's pushback whenever someone sees they're seeing a nurse practitioner or a PA, kind of their questions, and maybe they haven't experienced care from an advanced practice provider. But I do take that humbly. And if the patient's not comfortable, then that's my primary concern. I want them to be comfortable. If we need to switch, I get it. But not as of late, not as much. I do think it's really important for, again, the institute or the department. If you do have collaborative care teams, let that patient know up front, which we try to through education. We'll send portal messages that you are going to be seen by this team, meaning you may see one of these faces on this paper. No matter what team member that you're seeing, if you do need a surgery or the counseling, I'm a part of that team. I'm comfortable with it. I will take care of you. We will get it done. And I think that helps resolve a lot of things, just being very upfront and honest with the patient.
I try to do that a lot as well. I work very closely with physician assistants, Michaela, and a lot of times I'll tell patients straight up, I say, Michaela and I, we're like the same person. You know, we talk every day, multiple times a day. If there's any questions, she asks me. So I think they're comforted knowing that, and because it's hard for it's hard for the MDs or DOs to see everybody, and there's just not enough hours in the day. And having that collaboration with our APPs is really has been very rewarding for me as well. Michaela also works with us in the operating room, so she gets to come do some robotic cases and gets to see that side of things, which I think is a great thing for our program and for our patients, because a lot of times she'll actually operate on patients and then see them in follow-up, which is another thing that's wonderful about urology, is having that continuity of care.
I love it. And the rapport. I mean, myself as a patient, if I'm seeing a different provider each time I go in, that makes me feel uncomfortable. Yeah.
Yeah, for sure. Yeah. All right. One more segment, I think, to sort of take us to home plate here. Ashli, I'm going to start with you on this one. Any advice for younger folks that are thinking about going into medicine? I know you've got some children. They're not quite of age yet to go into healthcare, but what if they say to you one day, hey, I want to be a nurse or a doctor or go into healthcare? What's your advice with all the changes that are happening in the healthcare? Is it worth it?
Yeah, I guess I would encourage them to do it. I think it's a very exciting career. I would let them know that they're going to have to dedicate themselves to lifelong learning. It's not always going to be easy, but it is really exciting. It's fulfilling, and there's a lot of variety. So if you can really look in different areas that you could find your calling.
Yeah, I have a freshman in high school, and she's very much into medicine right now. So I'm having to sort of grapple with this question a little bit. And I've heard other colleagues say, oh, I would never tell my kids to go into medicine or healthcare. And I don't know. I think you got to support them and let them be who they are. What are your thoughts on the topic, Corinna?
I would say, despite your age, whether you consider transitioning your life in medicine, in urology, or, whatever role, shadow and ask questions and do what you think will give you the balance in life that you want. I think that is so important. I think as an undergrad moving forward, I've always had this frame of I want this excellent career. I want, type A, this is my career. That's all I care about. And then you get into that, and now you more so lean back and you say, I want that balance. I want to care for my patients, but also want to care for myself, make sure I can be like my cup full while I'm filling someone else's cup, which is hard to tell someone just to do, but I think shadowing is at least like putting yourself in somewhat in the shoes or right next to the shoes to get an idea of the experience.
Yeah, I'm not exactly sure my daughter knows exactly what I do. Yeah. She hears me talking about it and she sees me working. But yeah, I think you're absolutely right. Getting that one-on-one with somebody in healthcare really can show you, or you can watch an episode of The Pit. That also is a good one.
I have not seen that.
It's very realistic. I watched the first episode of season 1 and I was like, I cannot watch anymore because I feel like I'm at work.
Oh no. Yeah. Put that down.
Yeah. I was like, this is enough. Yeah. But very realistic. So that's another option. Watch The Pit. And then I guess lastly, this to round us out here, Corinna, looking ahead, maybe 5, 10, 15 years down the road, what do you see the role of APPs in urology in the future?
To answer the question that you had at first, as far as, our APPs are there for optimizing the role of urologic providers, I think the answer to that again is yes. And their role in the future is to continue to be essential in bridging that gap between patient demand and availability, still providing high quality care, improving access, but at the same time supporting the care team.
Ashli, I'll give you the final take. APPs in 15 years. What are they doing, and how do you foresee them being part of this sort of journey that we're on?
I think I see the more fellowships and more training for new grads, expanded procedure opportunities, and then also I'd like to see more involvement in research and speaking at conferences, and more APPs get involved that way too.
That's fantastic. It's really been great having this chats with Corinna Hughes from Mayo Clinic, as well as Ashli Ellison from University of Wisconsin. We've been having a great discussion on optimizing the roles of urologic providers. Is there an app for that? I'm Kyle Richards, your host. Our editor and producer is Sandra Miller. And thanks for tuning in to this episode of WInnovations.
WInnovations is a production from the Department of Urology at the University of Wisconsin-Madison School of Medicine and Public Health. Thanks for listening.